Good evening. Hello, hello. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Thank you all so much for joining me for Wellness Wednesdays with Dr. Wells. I first want to just say that I know for me and my family and many others that I know, we were able to get through this hurricane without any issues or any damage. I do know personally and just, by association, many who have been impacted heavily by this storm, this hurricane that went through Idalia. So we want to just mention that we have those individuals in our thoughts and in our prayers. And if there's anything that we can do, please reach out to us. We can see what we can do to assist you and to help get you connected with some of the community resources that we have access to. So please continue to be safe. Please continue to check on your loved ones and your neighbors and just do what you need to do in this time to make sure that you and your family are okay. Again, those individuals who have been impacted are in our thoughts and our prayers. It has cleared the state of Florida. From what I understand, it is now up in Georgia. So let's continue to pray for those in Georgia and, keep them in our thoughts and prayers. If you have any family there, please reach out and make sure that they are okay. As we move into the next few days, we are anticipated in especially those areas that are low-lying areas that are near water to see a lot of flooding or more flooding, because there are many areas that have experienced quite a bit of flooding. And so, again, just be safe, check on those that you know, your neighbors, and do what you need to do. Tonight, we're going to be discussing a very common topic. However, it's one that we've seen an increase in cases. So tonight we're going to discuss COVID-19. We're going to go over the symptoms. There's a new variant, so we're going to talk a little bit about this new variant. We're going to talk about when you need to go and seek medical attention. We're also going to talk about some of the things that you can do to treat COVID if you were to become positive with COVID. And then some of the things that I do and some of the natural remedies and things of that nature that I take and that I recommend, to take to help increase and boost your immune system. So COVID-19 is not new to any of us, right? We've been dealing with COVID for a few years now. The numbers had fallen off quite a bit, and we weren't hearing a lot about it, and we weren't necessarily having many cases of COVID. However, since July, we saw numbers begin to increase. And in fact, there was a decrease in the numbers, and then there was a stark increase in the numbers. And so I want to say around May, June, we began to see numbers decrease. Starting in May, it was a slow decrease in numbers, where by July 1st, the numbers had kind of plateaued somewhat. However, since July 1st, slowly the numbers have been increasing. And with that, the number of hospitalizations has increased as well. So when I was looking at the data on the CDC, with hospitalizations, number of deaths of COVID, we are seeing that those numbers overall are increasing. Increased number of positivity rates, increased numbers of hospitalizations, as well as increased numbers in deaths from COVID. So when I was looking at the information on hospitalization, because that tells us a lot, right? Anytime we have a condition and you have individuals that are positive, they can manage, many individuals can manage those symptoms at home and tend to do well. with managing the system with those symptoms and overcoming the symptoms and go on to do fine. However, you still have those individuals that are at high risk for um, major complications when they develop or when they become positive or test positive or contract COVID 19. And so when we're looking at the hospitalization rates, the number of deaths are kind of going hand in hand with that. So it's so important that we want to take care of ourselves, right? We want to make sure we are getting enough rest, make sure you're eating a healthy diet, make sure you're drinking plenty of fluids, taking your medications, monitoring your symptoms, washing our hands, right? Carrying the sanitizers around with us or with you if that's your thing. Some people don't like sanitizer and prefer to use the hand washing method, which is best, right? Anytime you have access to running water and soap, that is definitely going to be the number one or the top recommendation is to make sure we're washing our hands frequently and often with soap and water for at least 20 seconds. And however, if you don't have access to running water or soap, hand sanitizer is the next best thing. So making sure that you are washing your hands. If you are sick, if you develop symptoms, and we'll talk about the symptoms here in just a little bit, make sure you stay home and then also get tested. Go ahead and get yourself tested. I know my husband and I were having a conversation. We started seeing the increase in people wearing their mask out in public. And that's another indication that, hey, something is going on. We need to pay close attention here. So just wanted to put that out there really quickly for you. Another caveat or another plug that I want to put in here is any of the information that I provide you all with here is one based on data and research that I've done myself, and then things that I'm seeing in clinical practice. So again, if you have a primary care provider and you're not feeling well, I want to make sure that you are following up with those individuals and that you are reporting whatever symptoms that you have. Any recommendations that I have are just those recommendations. And you can take that information and utilize it, but I will always refer you back to your healthcare provider. So, what's the new strand or variant of COVID? You know, we've had many variants of COVID 19. And someone asked me the other day, why is it all these different variants coming? And viruses are smart. They replicate and they can change, their makeup. And so if we were to look at the Delta variant versus this new variant, which is variant EG5. EG5 is the new variant of COVID-19. The signs and symptoms of this variant is pretty similar to some of the ones that we were seeing in the past, right? But there are some symptoms that have kind of showed back up on the scene. I believe it was the Delta variant or the one before that, where individuals weren't losing the sense of taste and smell. But we're starting to see that again with the EG5 variant. When it comes to looking back at the different variants, there was one, I believe it was the Delta, where individuals were having the issues with like conjunctivitis and were in the hospital with infections of the eye and the muscle pain and the muscle aches. And they weren't having as many upper respiratory issues. As these variants change and they kind of get smarter, you may see differing signs and symptoms. So right now, what we're seeing with the signs and symptoms of this new variant EG5 are the fever, the chills, cough, shortness of breath, fatigue, muscle aches, headache, loss of taste and loss of smell, nausea, vomiting, and diarrhea. So these are the signs and symptoms that we're seeing now. Many of these signs and symptoms can be similar to other respiratory viruses, could be the same as other issues or medical conditions that are we've been dealing with for a long time, right? So how do we determine whether or not this is COVID-19 versus some of the other upper respiratory viruses or other GI viruses? And the only way to differentiate that is to get tested. So if you are symptomatic, we are recommending that you get tested. COVID tests are still available at your local stores, local pharmacies, and we definitely recommend that you get tested. So what happens? You develop these symptoms, you're doing well, you get better, you go on about your business. According to CDC, the recommendation is that you quarantine for 5 days if you test positive for COVID. And after the 5 days, then you are free to go back to work, be around other individuals. Got a question the other day where I took a test and it was negative, but I still had symptoms. Anytime you are having symptoms, we are recommending that you still quarantine yourself or that you still refrain from going to work and being around anytime you are sick. The best thing is to just make sure that you are staying away from others, doing what you can to protect yourself as well as other individuals. So, hospitalizations and when should you go to the hospital? So, as I mentioned, we have the new variant where the signs and symptoms are fevers. So, if you develop a fever or a temperature that's greater than 103 and it lasts for more than, I'd say, 72 hours, or it gets to a point where your temperature is increasing and you're not able to treat it or bring it down with some of the antipyretic medications or medications that treat fever, the Tylenols, the ibuprofens, things of that nature, then we want you to go in and get seen. Shortness of breath. If you are someone who has a history of asthma, chronic obstructive COPD, if you have lung issues and you develop shortness of breath to the point where you are really struggling to breathe, you're having difficulty breathing, uncontrollable coughing, wheezing, we need you to go in and get checked, okay? Because typically with adults, what happens is adults go into respiratory distress and then children typically go into respiratory distress and it leads to cardiac arrest. However, what we're seeing is with COVID-19 and what we saw in the past and what is still true is that individuals are developing respiratory distress, which then leads to cardiac issues and cardiac arrest. So we want to make sure that you are, one, able to breathe. So if you're not able to breathe, it can be very uncomfortable. So we want you to go in and get checked. If you are developing nausea, vomiting, diarrhea, and it lasts for more than 48 to 72 hours where you are not able to hold anything down, we need for you to go in and get checked. You can become dehydrated very quickly, especially if you have a fever, because that increased temp, your body is trying to cool itself down by sweating and, you're losing fluids that way. So we want to make sure that you are staying hydrated. So if that's the case, get in and get checked, go to the emergency room or urgent care, and chances are you'll get some IV fluids, okay? Some of the things that we do or what we're doing now to treat COVID, some of the same things that we've been doing in the past. We want to treat the symptoms. So if you have the fever, you want to take something over the counter, Tylenol, ibuprofen. Those things are known to bring down the body temperature, okay? You also want to treat any coughing that you have. You can take medication over the counter for coughing. You can take the throat lozenges, the cough drops, things of that nature that can help. If you have high blood pressure, you have to be careful with over-the-counter cold medications because there's an ingredient in regular cold medications that could increase your blood pressure even more. So there's medications that you can take, but it is HVP, over-the-counter cold medicines. And so that type of medication is approved for individuals who have hypertension or high blood pressure. If you have congestion, there's the Mucinex and other things like that that can break up the just lost the word, but the congestion in your chest. There are natural things that you can drink. You can drink teas and things like that, getting up and walking around, practicing deep breathing, so many different things that can be used to help with the chest congestion. Nausea, vomiting, diarrhea. There are medications over the counter that you can take that can help with those. However, if it gets to a point where, as I just mentioned, that you've gone for several days without being able to eat or hold anything down, we want you to go in and get checked. Antibiotics. Are antibiotics typically prescribed for COVID-19? Typically, no. COVID-19 is a virus. And as I mentioned before, with a viral infection, antibiotics are not typically prescribed or given for viral infections. However, if an individual develops bacterial pneumonia or a bronchitis or something like that, that does require antibiotics, it can then be prescribed after you've been evaluated by your healthcare provider or a healthcare provider, and they will then determine whether or not it is appropriate for you to receive an antibiotic. What are some other things that we can do, right? As I mentioned early on in the broadcast, we want to make sure that we're taking care of ourselves, right? Because if we are well rested, we are hydrated, our immune systems are strengthened because we've done all the things that we need to do to make sure that we are taking care of ourselves, we are less likely to become sick or infected. Or if you do develop or contract COVID-19, then you're able to get over it pretty quickly. Again, there are some individuals who don't get over COVID-19 as fast as others because of comorbid conditions and other factors. Okay. So again, know your body and know when you need to go in and get checked. Some of the things that I recommend, and during COVID, I did some research, and for my family, I had a whole cocktail of supplements that we would take each and every day. And we line up and take our supplements. And so I want to share some of those with you. However, again, as a disclaimer, I want you to, before you start any medication, before you start any new supplements or over the counter, always check with your healthcare provider if you have any other conditions, and do your research, do your homework, see if it's something that's for you. Some individuals will probably disagree with some of the things that I'm recommending. And again, everything is not for everyone, but I'll tell you what worked for me and my family. So there are several things that you want to look at when you are just for overall immune health, and things that I take pretty much every day, that I've been taking for some time now, that I found during COVID, it helped me, right? And so one of the things I really like is, I don't know if you guys can see this clearly, it's Emergen-C. It's vitamin C. You can put this in water, you can put it in juice. It really helps. This one is 1,000 milligrams of vitamin C. The recommended serving size is 1 packet. I tell you, I put this in my water a couple of times a day. There are certain vitamins that are water soluble. Vitamin C is one. So what does that mean? Is that if you're drinking water, you will kind of eliminate that whenever you urinate or you pee. So you can't really overdose, so to speak, on vitamin C. Vitamin C is really good at increasing your immune system, and it works well. There's some other forms of vitamin C, which I have here. You can take the capsules. This one works as well. I just tend to drink a lot of water, and this adds a little flavor to the water while I'm getting that vitamin C. Some of the other things that we recommend is zinc. and this is a 50 milligram capsule. So zinc, vitamin C, zinc. Vitamin D is another one that you want to look at if you're not already taking. Most of us are deficient in vitamin D as it is. And so, whenever there's a vitamin D deficiency, it puts you at a higher risk for developing many things, as well as being prone to developing or catching these viruses and things of that nature. So, the vitamin D is another one. Some of the other things that I take daily that help me is Juice Plus. This one is the berries. There's a veggie blend and there's a fruit blend. So it helps me get all of the daily recommended amounts of my veggies, fruits, and berries. There's also a omega one that's available as well. So if you want to know more about Juice Plus, definitely let me know. We can have a conversation about that. But those are some of the things that I take just on a regular basis. Now, when it came to COVID, there were several things that I added to my toolbox or to my medicine cabinet of medication that I take. Something else, anytime my family would get sick, whenever we had the cold and flu viruses going around, Sambucol or black elderberry was one of the things that we took. And I hope you can read this. The elderberry syrup was one thing that I knew for a fact, even before COVID came on the scene, that I knew worked for me and my family. And so with that, we added COVID. We continued during the COVID pandemic, we added this pretty much to our daily regimen. There's another one, and the name is probably going to shock some of you, but it's Kick A. I call it Kick A Immune. So I would make a cocktail with this Kick A Immune activator, and it's another supplement. It has some really good things in here that help to fortify or help increase your immune system, help build up your immune system. And again, before you take anything, make sure you do your research. Another thing that is I found to be really good after doing some research was the Echinacea complex. I also take this in teas. Echinacea tea helps as well. Another thing that we found, and I did some research on, is the quercetin. Quercetin is another immune supplement that builds up and boosts your immune system, and it helps with cellular function. So the important thing is, whenever you have a virus, the quicker you can get your cells to turn over, the better, and the quicker you are most likely to overcome a viral infection. And another one is, or virus, not infection, but another one is the NCA, which is the N-acetylcysteine. There's some research on this that states that it boosts cellular functioning. So it helps fortify your cells, which then helps them to turn over quicker than they normally will, which will help your body rid any viruses or make the cells a little healthier. So those are some of, I know those are a lot. And I tend to take a lot of supplements just because it makes me feel a lot better. I didn't have here, which is the vitamin B12. That is good. A B complex are some things that are good. You find what works for you, right? These are recommendations. These are some of the things that I do and I have my family doing. And my husband, I think this man has an immune system of an iron cage, right? Because we've done all of this and he has never gotten COVID. Someone asked me about vaccination. I am vaccinated, and that was a personal decision. I will never come on any platform, and vaccination to me is like talking to someone about politics. I will provide you with the information, but it's up to you to decide what you're going to do. Do I recommend vaccination? Of course I do. I recommend that if you are not vaccinated with the standard vaccinations, and some individuals choose not to be vaccinated and choose not to have their kids vaccinated. And that's their prerogative, right? So I'm never going to come and be pro-vaccination in terms of telling you you need to go and get vaccinated. I will provide you with the information. I'll provide you with the data and the research, and it's up to you to decide whether or not this is the route that you want to go. And so someone asked me, well, why don't you talk about vaccination? I will. Do your research, decide whether or not it's for you. There are some boosters that after those initial rounds of COVID vaccine, there were some boosters that were recommended and individuals got the boosters. Some individuals had some side effects from the vaccination, just like individuals have side effects from any of the other vaccinations that have been developed and have been out for years. But one thing I can say, when we look at some of the childhood illnesses that were very detrimental many years ago, vaccines were created for those and they worked. Some individuals have come and said they made this vaccine too quick. I'm just a little nervous about it. Again, it's your preference. It's your personal choice whether or not to become vaccinated. So I won't come on here and say you need to get. I will say these are your options and this is what you can do with that in terms of what you feel is best for you. So tonight we've talked about the new variant of COVID. We started off talking about some of the signs and symptoms of COVID and the new variant, which is the EG5. We talked about some things that you can do, the signs and symptoms. We also talked about hospitalizations increasing, the number of deaths increasing, and we talked about what you can do to treat the signs and symptoms of COVID-19. And also some of the things that I have in my toolbox or my medication, my medicine cabinet, so to speak, because we don't have medicine cabinets in new homes anymore. But some of the things that my family and I take that I find are very helpful. What do we do from here? Continue to take care of yourself. Continue to eat right, get enough sleep, drink your water, exercise, make sure that you're doing what you can. And if you're sick, stay home. Don't spread it to other people. You may do fine with it, but someone else who may contract it may not do well and may end up in the hospital. So let's do what we can to take care of ourselves. I want you all healthy. I want to be healthy. I want to be able to go outside, as we all say, we outside, right? I want to be able to go outside and enjoy being outside and going and doing things without having to worry about whether or not I'm going to contract COVID or if I'm going to get COVID. What are the chances of us catching it? Is still, the chances are out there. But as long as we're doing what we need to do for ourselves and taking care of ourselves, we should be fine. If you feel that you have any signs and symptoms, you want to get tested, again, you can do the self kits at home. They seem to be pretty reliable still, even with this new variant, from what I'm hearing. Do what you need to do to protect yourself. If you are in search of a primary care provider, as I mentioned before, we now have our own office. So we are able to take care of the full range of primary care services. We deal with urgent care and some minor acute care issues, medication refills, consultations, health and wellness coaching. We have it here for you at Wells Legacy Health and Wellness. We're located at 452 Osceola Street, Suite 106, Altamont Springs, Florida. Our phone number is 407-306-6755. I am Dr. Latoya Wells with Wells Legacy Health and Wellness, where our mission and our goal is to make sure and ensure that our family, our friends, and our community have the knowledge that they need so that they can advocate for themselves and create a legacy of good health. Until next time, this is Dr. Wells. Stay safe and be well. Have a great evening. Take care.